TCM affected liver illness. TCM affected liver illness. We're talking about two illnesses. One is convulsion. One is epilepsy. So that's kind of these two illnesses. They are pretty similar. They both have kind of muscle contractions, like a spasm. And they both possible, like losing consciousness. In TCM, both belong to internal wind condition. So that's belong to liver disorder. We're talking about the first one, convulsion. Yeah, convulsion. Chinese name, Jing Feng. Feng, everybody know, is the wind. Yeah. Jing is some people scared. Yeah, scared. Jing is suddenly getting fear. Scared people. So that's then convulsion there. So that's we talking about what means convulsion or Chinese name, Jingfeng. So if it is convulsion, pretty common, yeah, pretty common. So usually happens with other illness, like high fever. Then acute happens, yeah, it's a severe kind of disorder, basically clinical symptoms, seizures, and unconsciousness. So that's we say may happen for coming from other illness, other conditions, including high fever. So that's pretty commonly happens for young children. Under 5 years old. So usually between 1 and 5 years old. So in West medicine, that's a pretty emergency kind of disorder. Need immediately getting treatment. So that's basically it's kind of severe kind of disorders. So the reason still pretty complicated. When convulsion happens, the children will be seizures and losing consciousness. And that will follow other medical conditions. Mainly is high fever. After some other illness and cause the high fever, the children will be convulsion. So that's a pretty emergency kind of situations. So acute children convulsion, acute children convulsion. We say it usually happens suddenly. And mostly coming with EPI evading, fabric disease. Mostly is EPI evading and cause the fever. So that kind of fever usually is high fever. we say body temperature. Normally we say under 37.3. So we say generally 36.5 to 37.3. That's normal. That's normal. 37.3 to 38. That's low fever. 38 to 39. That's mild fever. Over 39 is high fever. Yeah, over 39 is high fever. So this kind of condition usually is high fever. And for TCM patterns, basically it's kind of heat pattern, or may flame pattern, or frighting for the children. Still can cause convulsion. And the wind pattern. That's generally TCM pattern here. So clinical symptoms, we say, usually show up high fever and convulsion seizures, means the severe kind of muscle spasm. How severe it is? We have one special kind of convulsion. The children may be like this shape. That's the head. That's the body part. That's the leg here. So mainly on the back part of the body is muscle spasm there. And the whole body pretty hard. Yeah, pretty hard. And the patient will unconscious. So that's mainly clinical symptoms. So that's generally we talking about. Then we talking about different pattern here. So wind heat truly cause the problems. Seizures, muscle spasm or convulsion, thus belong to wind. So thus wind heat can cause wind. So still acute onset and fever, and also possible have other symptoms, headache, nose blocking or discharging, or maybe cough, sore throat, and suddenly people losing consciousness and convulsion. So that's the mainly is most severe kind of disorder. The tongue usually not changing. Sometimes maybe have a little bit thin yellow coating because that's kind of heat there. And the pulse is floating and rapid. So we say this kind of condition, is pretty severe emergency kind of condition. And like the radio say, we try to bring the body temperature down to preventing convulsion happens. So for treatment pencil, we're talking about dispersing wind and clear heat and recover from the convulsion situations or stop convulsions. So the points, we must say this kind of condition for children is pretty severe kind of conditions. If convulsion happens, if at your home. Call 911 first. Yeah, call 911 first. And certainly same time, if you can use your needles or even nails to push into some special points there. But call 911 first. Yeah, call 911 first because that's pretty emergency kind of situation. Thus, if patient continually convulsion is not relieved, they may damage brain function later. So you can call 911 first. At the same time, you can use some points to relieve convulsion kind of situation. So 226, we know that's emergency kind of points there, especially for people losing consciousness. The first choice, that's the point. And then we can use full gaze moving qi, yeah, moving qi. So that's internal wind belong to liver issue. So we moving qi. And do 14 clear heat. Yeah, do 14 clear heat. Yeah, weaken needle. Yeah, so basically, better needle after convulsion over. Yeah, so during the convulsion time, better use your fingers, use your nails. Otherwise, patient convulsion may be broken the needles. Yeah, so that's basically after over the convulsion, then we can use needles. And the extra points, 实穴 top of the fingers, same function like a 经标 points. You still can, if you're bleeding there, yeah, if you're during the convulsion time, you are not maintaining the needle there, you just not leaving the needle there, still you can needle it, like some 经标 points, 实穴 points, do 24, you still can needle it. Yeah. So that's we talking about the treat once or twice daily with 3 times as one treatment section. That's basically happen in China. The children may be living in the hospital and treat with Western medicine and TTM same time. But still remember here, convulsion is a pretty emergency kind of situation. Call 911, go to hospital first. And same time, we can try use some needles. So that's, but not like children. Like today, convulsion is recovered, and then maybe after 2 hours, maybe convulsion again. So that's a pretty dangerous situation. So that's the first pattern. We talking about wind heat. Yeah, wind heat. The next pattern we talking about heat go to qi level and yin level. Means heat more deeper, yeah, more deeper. When we talking about 4 levels, first level is Wei level. So that's we say superficial level, superficial level. Like usually we talk about EBI wind heat, that will be on the Wei level. Yeah, EBI wind heat. That should be on the Wei level. Then the heat evading more deeply will be qi level. Qi level usually we talking about the 4 beat. The symptoms: big fever, big thirsty, big sweating. Certainly, patient thirsty, they will drink a lot of water. And the big pulse, stronger pulse. So thus, generally we say heat go to qi level. And then is the yin level. Heat more go to more deeperly. Yeah, heat go more deeperly. So that's the yin level. Wei level, qi level is the yang level. Yin level is the yin level. So basically, heat go to yin level. It's not that stronger kind of heat in there, but at the same time, patient will have different symptoms because heat damage body fluid, damage body in already. And the full level, last level is血 level or blood level. So heat go to 血 level or blood level, it will cause the bleeding problem. So now we're talking about the heat go to qi and the yin level. So means more deeper, yeah, more deeperly. So the symptoms and the signs, so still acute suddenly happens, and the patient high fever, still high fever. We say go to qi level, big sweating. And the neck stiffness and convulsion. And thirsty, another bigger here. And losing body fluid, constipation. Possible vomiting, nausea. So that's basically heat go to more deeper. Tongue is red and the yellow coating, that's the heat. Pulse is very pulse is the liver pulse. Patient convulsion, that's the internal wind, that's the liver issue. And rapid because heat in there. So these conditions even more severe. Yeah. Even more need to go to like an emergency kind of treatment. And some severe case even maybe cause the mental confusion. And sometimes they may hit combination with some phlegm inside. So that may cause tongue coating, breathing, and sleeping for the pulse. So treatment pays away still clear heat, extinguishing the wind, and open the orifice. That means hard orifice is blocking there. So still the same idea, yeah, still the same idea. We still need emergency kind of treatment. At the same time, we can use some points here. So still do 26, LI4, liver 3, moving liver T, and pericardium 6, commission, LI11, clear heat, spin 10, cooling blood. Yeah, so heat go to yin level, deep level, moving blood and cooling blood. So then we go to another pattern. Yeah, we go to another pattern. we talking about pathology evading, like internally to the heart and the liver. So basically, still heat phlegm pattern, like a phlegm blocking the orifice. So these patterns still severe kind of pattern. So suddenly happens, and the patient have a long-term high fever and thirsty, missing the heart orifice, dilute, and even karma. So these kind of patient maybe happens karma first, and then conversion, or maybe repeatedly conversion. So basically, this pattern, it should be in the hospitalized already. So long-term high fever. And also the eyes looking upward and fixed there. That's still caused by internal wind, severe kind of wind. So tongue is red with the yellow greasy coating there. That's a heat phlegm. Pulse is rapid. So this pattern even more severe. So treatment principle, we still like a clear heat open the orifice and soothing the liver, distinguish the wind. So the situations, the situation is more severe compared with other patterns. We especially go to the heart and the liver and clear internal heat. So that we can like mainly needle it and withdraw immediately. And maybe if during the time, like the children little bit shut down, not like a convulsion in there, we can keep the needle there about 20-30 minutes. But still remember, this kind of situation, it must be treatment with modern medicine same time. We are not only treat this kind of situation with TCM. Another pattern we talking about damp heat, epidemic kind of toxin. What means epidemic kind of toxin? Like right now we talking about COVID-19 infections. So still belong to EPI condition, but it's more severe. It's more severe. So symptoms and signs still long-term high fever and repeatedly happens convulsion, sometimes relieves, then convulsion again, and losing consciousness, and still have Shen disorder. And possible have like abdominal painful or vomiting, and usually stool is sticky, and even some pus blood inside of stool. So even more severe kind of disorder. So we know when we talking about toxin, usually cause severe kind of disorder. Tongue is red, yellow coating, greasy tongue coating there, and pulse repeat and rapid. So treatment principle we still clear heat and resolve dampness and relieve toxins, distinguish the wind. So the points, the points, pretty similar like we talked about before. Moving liver qi and clear heat, calming shen, and emergency recover for consciousness without flood. So truly this one, you can use bleeding. Yeah, you can use bleeding. Relieve some heat toxins. So bleeding, you can go to Jingmiao points. You can go to actual points, Shixuan. So bleeding. Still need treatment with modern medicine same time. Don't try treat in your clinic or maybe for your family member. So treat with West medicine same time. We have a special pattern. This pattern convulsion caused by the fright or fear. So like suddenly something scared children can cause the children convulsion. So we're talking about many patterns before, mainly caused by illness, especially EPI evading and cause the heat, and the heat gradually go to internally, cause the high fever. But this one, so mainly it happens suddenly attacking by the fear, scared children, scared children. Then like got some convulsion, basically kind of troubling of the bodies. And children maybe cry. So that's possible convulsion, and possible mental confusion. So if we feel the pulse may be irregular pulse, or maybe moving pulse. Moving pulse, kind of like a pulse coming, like a jumping there, suddenly coming, suddenly disappeared. So that kind of pulse can truly coming from the frighting and the fear. And we're looking for the wind. Yeah, we're looking for the wind. Basically, some stagnation in there. Yeah, pupil color and some dark color kind of stagnation there. So basically, fear causes qi, like stagnation. So this pattern not necessarily have high fever. So treatment, truly we need calming the shen. And the patients still have internal wind symptoms there. We're still soothing the liver and extinguishing the wind. This one truly you can treat like at your clinic or maybe for the family members at home. So this one not that kind of severe kind of convulsion, not that severe kind of emergency situation. So the points, basically the points we use already, and the kidney points, thinking about our emotions. Fear is controlled by the kidney. So patient fear, that's truly we need to tonify the kidney. That means if they're scared by something, that's truly damage kidney function there. So that's basically we can follow the ruler here. We can leaving the needle there 20-30 minutes, or maybe just manipulation needles and then we drop needles. So we can treat once or twice a day. And after 3 times, stop a couple days. And then if a patient still not recover, we treat it again. So that's 3 times as one treatment course means we stop. Yeah, we stop sometimes. Waiting body like some recover and also get some rest for the points. So that's we finish acute one. Then we talking about chronic one. So chronic evidence kind of convulsion. So basically have long-term durations and slow coming. And it's not that strong kind of muscle spasm. Still muscle spasm, but it's not that kind of severe. And it repeatedly happens. Sometimes better and sometimes happens. So usually is like not that severe disorder. We're talking about like difficult to solve and often have like combinations with karma or parasite. So that's chronic convulsion could be generally like some weakness. So deficiency problems always cause chronic problems. Chronic problems usually relationship for these problems, like a spleen stomach disorder or spleen kidney yang disorder. So that's basically deficiency there and cause liver yang rising kind of disease. So the first part we go to spleen deficiency, liver yang hyperactivity. So spleen generally is qi deficiency symptoms. So spleen qi deficiency, poor appetite, shallow face, losing stool, and some burning kind of sounds coming from abdominal area. And the spleen qi deficiency may be lending to yang deficiency. Then cold limbs. And then you can see the patients twisting the arms and the legs, and some shaking, shaking head, and rolling the eyes. That part belongs to liver, internal wind. So that's with a spleen deficiency liver pattern here. Hang pill still spleen qi deficiency or yang deficiency kind of tongue. And the pulse is deeper and weaker. Deeper pulse, internal disorder. Weaker pulse is deficiency. So mainly is deficiency. So treatment principle, warming middle gel. Yeah, warming middle gel tonified the spleen. So patient qi deficiency, yang deficiency, with warming and soothing the liver. Yeah, soothing the liver, distinguish the internal wind. So this pattern, we still can use maxa. Yeah, we still can use maxa. So acupuncture points, yeah, we tonify middle gel, yeah, spleen and stomach, back shoe, regular middle gel, 人跳, and the qi tonified, 人 6, stomach 36. And the problems conversion is internal wind situation, relationship with liver. So that's liver points we use reducing technique, and the other points we use tonify technique. And we can use maxa also. Maxa, backshore of the spleen, easily understanding. Do fall, easily understanding. That's spleen yang tonify. Do 14, most case we use clear heat condition. But truly we can use do 14 to tonify yang. Thinking about all the yang meridians connected with do 14. So that's kind of yang deficiency. We still can tonify there. We can mark that there. So usually heat in there, we can do some reducing technique. Now we do some tonify technique there. And the Renfo is pretty stronger tonify point. Ren 6 门雷气 tonify. Do 20 rising yang qi. Stomach 36 qi tonify. So that's we can treat every day and with 5 times as one treatment section. So chronic convulsion we can treat. Yeah, chronic convulsion we can treat. It's chronic problems. But acute convulsion is emergency kind of situation. Then we're talking about the pattern, spleen and kidney yang, severe kind of difference. Decline still means difference, but it's severe. So Monday, yeah, Monday we still can have generally spleen and kidney yang different symptoms like a cold limbs, clear urination, losing stool. For convulsion part, yeah, for convulsion part, or internal wind part, slightly trembling of the hand and the feet. And the severe kind of spleen deficiency, yeah, severe kind of spleen deficiency. People sleep, couldn't totally close the eyes. They keep the eyes half open, yeah, half open. So we say eye leaders controlled by the spleen. Severe kind of spleen deficiency will cause these problems. and so cold inside. Even sometimes you put your hand close to the infant's mouth and nose, you feel kind of a cold air coming out. So still kind of severe kind of conditions and even cold, sweaty. So tongue is still tongue. Pulse is deeper and very weaker. So that just means very weaker. So this condition is more severe. Is more severe. Young declines, pretty close condition. We're talking about young collapse. Young collapse. So that's also severe kind of condition. So we need a warming. Certainly we need a warming. Restoring young and the service condition for young collapse. So these conditions still need to go to hospitalize. Yeah. Still more severe. Yeah, still more severe. So we can treat with West medicine together. So maxa, yeah, maxa, more warming. So basically we have pretty similar like the points here. Even Ren 4, Ren 6, also Ren 8 is pretty good for maxa. And the indirect maxa, we talked about before in our TNT class with the salt. Yeah, with the salt. Salty fever go to the kidney. Yeah, salty fever go to the kidney. So all body yang originally coming from the kidney. Yeah. So yang collapse condition, we go to salt indirect maxa. Yeah. Put the salt on the body first. Especially Ren 8 pretty easily put a lot of salt in there and put maxa over it. And then burning the maxa until it totally burning. The salt is still warming there, can keep a pretty longer time. So that's for young collapse conditions. And for the points, yeah, for the points, back through of the spleen, back through of the kidney, and liver issue, yeah, find more, yeah, liver 13, find more of the spleen. Pretty good for the condition, both liver and the spleen, and also middle jiao. 人肉 pretty nourishing, tonified. And the yin tang coming shen, my favorite points. And spleen 6, some yin nourishing, and 3 yin channel, like regularly in there. So mainly points we use tonified technique and plasma. So that's for this pattern. Next pattern is yin deficiency pattern. In deficiency, we have general symptoms in deficiency, like 5 central heat and night sweat, frequently sweat, mainly in the night, and dry, dry stool, even dry throat, dry mouth, kind of deficiency heat inside. Then the wind aspect, wind aspect. So limbs spasm or hardness. So that's basically, and maybe scissors. So the tongue, Formosan kind of tongue is dark red tongue. That's what we're talking about. Dark red and more dry. Maybe no coating, maybe slightly coating there. Serrated rapid pulse. That's indifferency kind of pattern and generate some wind. So treatment principle, nourishing yin and subduing yang, so indifferency yang rising. And nourishing the kidney, nourishing the liver, distinguishing internal wind. So the points, So we still use Ren4, nourishing 25 points, and do 20, rising some yang qi. And we go to back through of the liver and the back through of the kidney. So that's basically some tonify in there. And the liver 8, liver inertia, liver blood, liver inertia. Spleen 6, 3 inertia. Kidney 3, yuan south of the kidney, tonify the kidney. Liver 3, yuan south of the liver, still liver tonify and nourish. And we also can use maxa. We say use maxa after needles. So basically we say maxa is more tonify. And usually maxa we are not used for heat condition. In difference, it must be have some difference heat in there. So that's basically we use needles, relieve some heat from nourishing in, then we do massage. So we still treat every day and 5 times as our 1 sections. So what is the medicine treatment? So basically we're talking about convulsion, especially acute convulsion. It's a pretty severe kind of disorder. So need to treat as soon as possible. So that's we're talking about acute convulsion, call 911 first. And also will treat originally caused illness same time. Like mainly we talking about EPI infections will have like a high fever. So truly need to control the fever, like find the reason what caused the fever. If caused by like bacteria, truly we need antibiotics. So that's for vice medicine is pretty severe kind of disorder also. Then we're talking about the prevention. So prevention basically we're talking about generally like get more body 正气, increase some physical activity. That means not sick, not illness yet. It's not during the convention time. So generally give children more like exercises and make their body stronger to preventing any kind of illness, not only convulsion. And also the vaccine. Vaccine preventing lot of illness, including like a flu infections. So that's another way preventing the illness. And keep the hydration. Yeah, keep the hydration. And avoid to falling down. So that can cause the children scared. We have part especially children scared and then cause convulsion. So that we avoid for that situations. And if patient like got convulsion before, like a patient fever, then convulsion before, then patient got sick or illness, they got fever again. So immediately cooling the patient in case that high fever still cause the convulsion. And also we can give some like drugs to prevent high fever. So we know that the illness mainly cause the high fever. So truly we try to preventing high fever. So generally speaking, a fever is kind of our body protected function. So people getting sick and then their body temperature will be increased and get a fever. Especially like a bacterial infection and the virus infection cause the fever. So our body temperature increase will kill like bacteria or kill the virus. So that's part of our immunity function in there. For the adults, generally say if the temperature like below 38 degree, or even below 38.5 degrees centigrade. Generally say we are not suggest use drugs to try to like decrease body temperature. We say that's basically your body is fighting with pathogen in there, but not for children. Yeah, not for children. So basically, children get fever pretty easily got convulsion. Even sometimes we say high fever cause convulsion. Even sometimes over 38 degrees, still pretty easily cause convulsion. So that means if especially patient have convulsion before and then fever again, even close to 38 degrees, not over, we still try to cool it down. Yeah. We can use drugs also. Sometimes we can just use the physical way. Yeah, put some cold towel on the top of the head and use the warm water. Remember, not cold water. Patient got fever. We couldn't immediately get the cold water on the patient's the body. Yeah, warming water washing the body, especially on the arm and the leg area. So that's in this way try to reducing some fever. And we're talking about if patient have some other illness, originally other illness, we need treat like our original illness. and preventing like a recurrent convulsion. So that's the preventing part. Nursing care. Nursing care will have a specially during the convulsion. Muscle spasm there. Not forceful. Try to like stop convulsion. So that's basically preventing the bone is broken. So like children get convulsion there. If you try to forceful recover to normal like location of the limbs, that may be called the bone broken. And like the children lay down lightly and hide lightly. So that's basically in case some phlegm blocking the respiration tract there. And also put the tongue, put the tongue cover with gauzes. And like wrapping with the gauzes in case during the convulsion, pretty possible, like the teeth, like injure the tongue in there. So that's kind of for preventing there. And the airway clear, that's more important. If patient have like a phlegm in there, clear the phlegm. And in severe case, maybe need give oxygen. And keep the room quiet. Yeah. Some pattern truly caused by like a fear. So that's basically avoid suddenly something sounds coming or suddenly something happens. Stimulations. And also always looking for the children, like what's their conditions, like looking their face, looking their breathing, and feel their pulse to see if something changing, like get the situation worse, get the treatment immediately. So that's for the illness convulsion.